Hello, friends at Retina Channel Podcast. Welcome to another episode of this series. Those of you who are new to this podcast, this is a retina focused journal club with the goal of bringing you what's most relevant and new in the field of retina and sometimes general ophthalmology topics. I'm your host, Dr. Kevan Kushan from Toronto, Canada, and today I have the distinct pleasure of having Dr. Wei-Chi Wu from Taiwan. Dr. Wu will be one of our guest speakers in this coming Canadian Retina Society meeting in Vancouver, all the way from Taiwan. And today he will be talking about one of his pediatric endeavors on retinopathy of prematurity. He'll be talking about the 8-year results of cognitive development in children who had retinopathy of prematurity and whether they were treated with laser or were treated with anti-VEGF injections. And he was very kind, to be very flexible with me in organizing this meeting. And I missed our initial appointment because I slept in, but he was very kind to pick up, and we could thankfully do this interview. Some background about Dr. Wu. He's a professor of ophthalmology at Chiang Memorial Hospital in Lingkou, Taiwan. He did his PhD at Chiang University. He completed his fellowship and postdoctoral research with Dr. Michael Treese at William Beaumont Hospital in Royal Oak in the US. His main research interests are pediatric retina, including ROP, including familial exudative vitreoretinopathy, Coast disease, abuse of head injury, and pediatric retinal detachment. He is the editor of Translational Vision Science and Technology, the American Journal of Ophthalmology Case Reports, and he has authored more than 330 papers and 8 book chapters. I'm very privileged to be able to have Dr. Wu for you here in this podcast, and also privileged to be able to actually have him in person later this month in Vancouver during the Canadian Retina Society meeting. Well, without further ado, this is Dr. Wu. Hi, Dr. Wu.
Well, nice to see you.
Nice to see you. Nice to meet you again. I'm so sorry I missed our original meeting. You're very kind to come back.
Oh, no. It happened. I
Yeah, but it's
continue in the
embarrassing for me.
past.
You're very kind. It was we had this party last night in our practice, and I
Oh,
so I kind of didn't wake up at time this morning. So thank you again for coming back to your office and joining the Retina channel.
it's my honor. It's my
And
honor.
it is my
Thanks
honor to
much
have
for
you, and
your.
I look forward to next month when I get to see you in person in Vancouver.
Yeah. I'm really hoping that the Retina Society in Canada and the Retina Society in Taiwan have a stronger interaction, connection in the near future.
Yes, and we're working on that. I know you're working on that, and
Yeah.
you coming here to Canada is a great first step, and we'll work on it and collaborate more in the future. So
Yeah.
our listeners and viewers know you're one of our guest speakers next month at the Canadian Retina Society in Vancouver. So that would be great. And so this is a nice introduction for that. Although I don't think you're going to talk about this particular paper next month, but I got really intrigued by your paper on the 8-year results of the
Yeah,
cognitive development of children
yeah,
who get treatment for ROP, whether it's with laser or with anti-VEGF injections. And then you had a very nice, um, pretty much prospective look at these kids
yeah.
um, to see what's different. So if you don't mind, I would love to hear about it. So um, who did you enroll in this study, Dr. Wu, and how did you select these kids?
Thanks for having me. We actually are very interested in this topic for years. So starting from 2016, 2019, 2021, 2022, 23, and this year, last year, 24, we have a series publication in this topic. And because um, the right now everybody knows that the use of anti-VEGF for ROP treatment is very effective.
Yes.
But despite its very positive effect in the eye, people actually have deep concern on the systemic organs,
Mm-hmm.
especially the brain. So people worry what happened if the eyes got better after the treatment, but the brain got worse.
Yes.
Because all the anti-VEGF drug after the intravitreal injection, they circulate to systemic circulation and cause systemic VEGF suppression for at least 1 week to almost 3 months,
Wow.
according to our prior study. So different anti-VEGF have a different duration of systemic VEGF suppression. And we know VEGF is a very important neurotrophic factor for organ
Mm-hmm.
development. And so this is a key factor associated with a normal organ development in the brain, in other organ like lung, kidney, and very important factor for wound healing. So
Mm-hmm.
people always have this concern in their mind whether this treatment would have a long-term impact because the kids we are treating are the most vulnerable group of patients. So
Yes.
these kids are premature infants, and if you let them expose such high level of anti-VEGF and cause significant suppression of systemic VEGF,
Yes.
people definitely worry about this because our brain need VEGF so that they could develop properly, they could function properly. So if
Yeah.
you have a suppression, would that result in long-term impact? So
Yeah.
that's
Yeah.
the
Makes sense.
rationale.
Makes sense.
We did this study in this cohort patient. So
Yes.
so we started from the we actually from the animal study, then we started from the retrospective study, then we have the prospective cohort. We follow them up continuously. Then we
Yes.
also look at the not only the data from single center, we also look at the Taiwan, the network from all the major hospital in Taiwan. So we also did a study called Taiwan Premature Infant Follow-up Network Database Study, and we published in 2023 in HAO.
Mm-hmm.
So, so we have a variety of data. We look at the issue from different angle and cross-check the information we have. So
Wonderful.
yeah,
Wonderful. And it's a topic that we all want to know about, as you said, because these are already very fragile kids who are preemies, and any insult to the brain development would
yes,
probably matter.
yes,
So this is a wonderful, wonderful endeavor. So you picked up kids who were somehow between 6 years and 12 years, and they had ROP treatment, correct? They
yes, we
had ROP treatment, PRP or bevacizumab or
yes,
Avastin, and
yes,
then you followed them. Is that correct? So you
yes,
started
yes.
those kids, you followed them for a few years.
So we have in this study, we have enrolled four group of patients. Group one is a full-term infant.
Hmm.
Group two were children who have prior history of prematurity without ROP. Then who have the third group will be the patient who have prior history of ROP but without needing treatment. And
Hmm.
last group was the group of ROP patient needing treatment. Of course, we subdivided them into laser versus the anti-VEGF.
Yes.
So I think with these different group of patients, we could make a proper comparison.
Yes, you had so many things to compare to each other. So kids no
Yeah,
ROP, kids with ROP, with
yeah,
preemie and no ROP, or preemie ROP not needing treatment. or ROP that needed treatment with VEGF or anti-VEGF, or some people had both. Is that correct?
Yeah. So to simplify the analysis, so we compare the full-term baby and the preterm without ROP versus the ROP without or with treatments, and we found that ROP group did have worse neural development, worse score, FIQ, full intelligent quotient score, compared to the full-term or preterm without ROP patients.
So that's the first step. If you
Yeah, that's first
uh
step.
yeah, that's important. So these kids did not need any treatment, but they already had less development.
Yes, they do have a lower score. Then we further look at the patient who have ROP uh, without and with treatments. And I think the most important message is that if we compare the patient with anti-VEGF versus the laser treatment, there was no significant differences.
Yes. Yes, that's important. So these are the most vulnerable kids in your cohorts who had
Yes,
ROP and had treatment.
yes,
And you
yes,
demonstrated in the subgroups in that group, the two essentially did the same in terms of neurodevelopment uh, at the beginning to end of the 2 years that you followed them.
yeah. And in our prior study, we actually found out that the group who have combined laser and anti-VEGF treatment has the worst score.
Yes.
Okay, but we also look at their gestation age. And in that group of patients, they actually have the youngest gestation age. So if you did the multivariate analysis and control the gestation age, I think the most important data that come out is that for the children who have anti-VEGF alone versus laser alone, they do not have a significant difference in terms of their FIQ score, in
Mm-hmm.
terms of their cognitive function. So
Mm-hmm.
because they are on the same basis, they have similar gestation age and the birth weight and
Mm-hmm.
similar baseline demographics. But of
Mm-hmm.
course, their baseline demographic would be so much worse than the group who have ROP without needing treatment, or who have who don't have ROP, they have prematurity only.
Yeah. So the farther you go along that spectrum of the cohorts, the
Yes,
worse the FIQ score becomes, you know. So
yes, yes,
ROP needing treatment, they do a bit worse than ROP not needing treatment.
yes,
And
yes,
any ROP does worse than preemies with no ROP, correct?
yes.
Okay.
Seems
But
that
within the group that needed treatment, they're the same.
yes, it seems it's like a
Yes.
spectrum of diseases.
Yes.
Um, and we also did a multivariate analysis and found out that the two factors that come out associated with the FIQ score were the patient's vision and their gestation age.
Mm-hmm.
The patient have a better vision, and heavier, they have higher gestation age, older gestation age, then their score will be better. But
Interesting. So,
on the contrary, if they have worse vision and the lower gestation age, then their FIQ score would be lower.
which is
So
consistent with the first finding that, worse ROP they got, probably the vision is maybe less, probably gestation age is also less, it's kind of it's
yes, yes,
consistent.
yes.
Okay. Very nice. So how did you measure the FIQ scores?
In this study, so the neurodevelopmental outcome has to be measured according to patient's age.
Mm-hmm.
And in this study, we use a risk 4 Chinese version is that's Wei-Chi intelligence scale for children, fourth edition.
Mm-hmm.
So we use this. This is a study fitted for older children, so that in the prior study has consistently showing that it's a very reliable, consistent test for these
Mm-hmm.
kids,
Is
and
it
it
like an examination, paper and pencil type of thing, or is it some maneuvers or movements?
yeah, there
What
are
is?
lots of tests done by the pediatric psychiatrist. A lot of tests. For
Okay.
example, if they need to do some reasoning. For example, if A A A is bigger than B, B is bigger than C, that means A is bigger than C.
Right. Right. Okay.
Things
Okay.
like that. So it has to be done. It's a very time-consuming test, but
Okay.
it's a standard test for FI.
Gotcha.
And
And
so
you did it twice, right? Beginning and end of the study?
yes, yes, yes.
Okay. Okay.
So in our prior study, we published in 2021 HAO. In that study, found we tested patient age 4 to 6, and we did the test every year. And we have a very interesting finding is that during this follow-up, the gap between groups actually a little bit narrow as
Mm-hmm.
it gets older. So I think there's a catch-up effect uh,
Okay.
in this most vulnerable group of patients.
Okay.
There, yes, you could make their neurodevelopmental outcome better by education, by treatment, by rehabilitation.
Okay. That's the message of hope, so they
And
may get better with time.
although they could not fully catch up with the full-term or premature infant without RP, but the gap is narrow.
Okay. Okay. Oh, that's very good to know. That's
Yes,
message of
yes,
hope.
yeah.
Very
So
nice.
that means if you have early intervention, actually they could
Okay.
lead a very healthy, normal life and with proper neurodevelopmental outcome.
Okay. And your study was fairly large. I think you had 277 kids who were enrolled in the study, so
Yeah,
that's fairly
yeah,
strong. In the last group that you had, the ROP with the treatment,
yes.
um, how many did you end up having in that group? I probably have it here as well. The
We have 67.
67. Okay. So that's the
60,
group that we're more concerned with, right? The group that had
yes,
the
yes.
treatment, and that probably
So,
half of them had the RP, had laser, half of them did not, and they end up being the same.
yeah, so laser 12 patient, uh, bevacizumab injection 38 patient, combine both 17 patient.
Yes.
So we compare these three groups.
Okay. And
Uh,
statistically, the differences were significant or were not significant, correct? Like in terms of
yeah,
when, yeah,
yeah,
when the,
if you it end up non-significant among these three groups, although you do see that the mean score in the combined group was lower, but
mhm.
p-value was over zero point zero 0.05.
Okay. So
But
the,
you
the
do
the two
see that,
subgroups were not different then. Okay.
yeah, you do see lower score and lower percentile in the combined group of patients.
Yeah.
Maybe our patient number is still not big enough, but I think this is so far one of the largest study in
Yeah,
this
yeah.
category
It's
already.
hard to find kids who had treatment and especially
Yeah,
one type of treatment.
yeah,
No,
yeah.
so I think this is amazing. So it does, are you more confident now that when you're treating a kid, you do a lot of pediatric retina
Yeah,
yourself, when you're treating kid with bevacizumab, you're not harming their brain development more than you would with laser. Are you more
yes,
comfortable that way?
yes. I feel very comfortable with this data. So when we talk to the parents, they feel comfortable as well. And also recently, the randomized trial, like a rainbow or firefly, butterfly, they they consistently show that there was no significant neurocognitive impairment in the group of patients treated with anti-VEGF versus laser.
Yes.
I know that article, a few articles, they do show lower score um, in the anti-VEGF treated group compared to laser. But when you look at those articles carefully, you will always find some issue in their baseline characteristics. For the
Okay.
infant treated with anti-VEGF, usually they are smaller, with
Okay.
smaller gestation age and smaller birth weight. Yeah, so those are confounding factor you
Okay.
need to consider.
But you made sure the two groups were the same in terms of age and gestational age
Yes,
and weight, they're the same.
yes, yes,
Okay.
yes.
Okay. Very nice. So, Dr. Wu, what do you want us to remember? I mean, we talked about multiple times for our listeners and viewers and readers of your article. What's the punchline? What's the take-home message?
Yeah, I think um, the take-home message is that anti-VEGF treatment is a very promising treatment. It's less invasive than laser, and of course, so much less invasive than cryotherapy for RP patient. It's
Yes.
like a progress over the years. So we
Yes.
have a treatment that would not significantly damage the retina and cause like a peripheral field defect and result in less refractive error for the kids and also a better fovealization in these kids and they would have a better bare vision, less refractive errors, although the best corrected vision remains similar between laser treated group and anti-VEGF.
Yes.
But of course, I would say anti-VEGF has their issue too. But in the long-term neurodevelopmental concern, um, in this aspect, I think we are feeling more comfortable, feeling more confident that as we collect these data, we consistently show that there was no significant differences in their neurodevelopmental outcome in the
Yes.
patient who got the anti-VEGF versus laser treatment. So,
Wow. Yeah.
so I think you should have two weapons at hand, laser and anti-VEGF, and use appropriately. Sometimes you could combine them for the tougher cases, but but I think overall speaking, these treatment actually result in very good outcome for these kids.
Wonderful, wonderful. Well, I want to thank you for publishing this work, and really, this is a significant contribution to our field and all the work you've done in the field of ROP and the rest of Retina. And thank you for coming to Retina Channel podcast and sharing your insight with us. And I appreciate it, and especially the time difference and the mishap on my part.
No, no,
Uh,
no, no. Thanks
and
so much for having me.
Of
Yes,
course, and I really look forward to meeting you in person next month in
yeah,
Vancouver, and then
yeah,
we'll get a lot of talks from you, and that would be great.
yeah. I'm very looking forward to my visit to Canada.
That's
Thank you
amazing.
so much.
Well, you have a good night, and then I'll see you soon.
Okay, thank you so much. See
Thank
you.
you.
All right, folks, this wraps up episode 86 of the Retina Channel podcast with our wonderful guest, Dr. Wu from Taiwan, with this great presentation on the 8-year results of the cognitive development in children with ROP who received treatment with either laser or anti-VEGF injections. I want to thank Dr. Wu for being so flexible in his timing, and also I look forward to seeing him and meeting him in person later this month at the Canadian Retina Society annual meeting in Vancouver, British Columbia, which will be from April 25th to April 27th. So if you have not registered for the meeting, make sure you do so.
I'll put the link in the show notes at the end of this episode. And it promises to be a wonderful meeting. We have Dr. Wu, as I mentioned, and we have other guest speakers from around the world who will give us wonderful talks, and we also have many Canadian researchers giving us their results. So hopefully I'll see you in Vancouver, and if not, I'll see you in the next Retina Channel podcast episode. Bye-bye.